Hey guys, thank you for coming back to my channel. I just made a video about what to expect before surgery. Now I'm making a video about what to expect after surgery. Okay, so let's get started. So the first thing that's going to happen is a veterinarian or technician is going to meet you in the room, and here they'll give you instructions on a piece of paper to go home with for post-op care. So the instructions that should be on the post-op care is saying that your pet has been through general anesthesia, meaning that your pet's going to be a little unsteady on his or her feet for a couple of days, and also be a little bit more sleepy than normal. Another thing that should be on there is that your pet may or may not cough. That is due to the tube that we put down their trachea. Sometimes it irritates them, sometimes it doesn't, but just keep that in mind that they still may cough because of it. So I know a lot of owners are always concerned that their pet hasn't ate all day, and they're very concerned about it, and they want to make sure that their pet does eat that day. Now, sometimes anesthesia does make the pet, their stomach feel a little nauseous. So they may not always want to eat, or they may eat and they may vomit. That is normal. If your pet is nauseous, signs are usually drooling. They usually go to the food bowl and look like they want to eat, but they turn it away. Also, they're always licking their lips. That could be another sign of nauseous. Sometimes veterinarians prescribe nausea medication to go home with, along with the pain medication, just to avoid them to have this issue and make sure that they do eat. Now, the other big thing is if your pet goes home with an e-collar. I know, they all hate e-collars. Sometimes I think us owners hate them more than actual patients themselves, but I understand they absolutely most of the time hate it. Now we put the e-collars on, also known as the cone of shame. We put these on the patients just so they don't lick at the incision, or they don't try and bite off the sutures or the staples, whatever the veterinarian put on them, and also to keep it clean and make sure that they're not infecting their incision. I know how much they hate it. There are another option, as far as instead of using an e-collar, you can, if it's a spay, depending on where the incision is, you can put a shirt on the patient as long as it's covering their incision. Unfortunately, neuters, their incision's a little far back, so it's hard to cover that with a shirt. So unfortunately with them, there's really not an option for them, but for spays, you could just put a shirt over them, so that way it keeps it clean, it keeps it covered, so they can't really lick at it even if they want to. And then a lot of clients use these soft collars, which sounds great, but I personally don't like them because they usually are not clear, so they can't see the sides. They can only see straight forward. They can't see anyone coming from the side of them. They can't see anything on their side view. So that's why I like the clear e-collars. I know they're plastic. They feel probably really bad, but at least they can see on their side, and I feel like they're more happy with the clear e-collars compared to the soft cone e-collars because they can't see on their side, and I think they like it more. It's always important to make sure that the e-collar is exceeding over the nose. I have seen that dogs and cats still are able to lick their incision with the e-collars on. On the instructions, it may also say to warm compress the incision or ice the incision. It also should say to always check the incision, making sure it's not red, swollen, or making sure there's no pus coming out of the incision, which will probably be infection. So just making sure that doesn't happen. If it does, please call your veterinarian as soon as possible, and let them know, and you'll probably have to come in for them to check it. Alright everyone, so that's it for this video. Feel free to subscribe to my channel, that would be most appreciated, and hope to see you soon. Thank you.